Okay.
Hi, everyone. How are you today? My name is Brittany Doan. I'm one of the clinical directors over at Behavioral Framework, and we are here for our Avoiding Meltdowns Strategies for Stressful Situation webinar. I really hope that previously stressful situations will seem manageable after our time together today. We'll just go through and do a little bit of introduction. So welcome. We are so excited to be able to partner with Pathfinders for Autism to bring you this Avoiding Meltdowns webinar. Like I mentioned, my name is Brittany Doan. I'm one of the clinical directors over at Behavioral Framework. I've been a licensed BCBA for 4 years and in the field for around 10. I've worked in a lot of different clinic settings, school, and the home, but most of my BCBA career is with Behavioral Framework. We are an in-home ABA service provider in the DMV area. We're a BHCOE accredited company and also a member of the Council of Autism Service Providers. Meltdowns are especially close to my heart, as in my career, I've observed time and time again how decreasing challenging behavior allows our clients to interact with their natural environment, and it really opens up so many doors and opportunities. So I'm super passionate about supporting families and community members with behavior reduction strategies that will do the same for your clients or your loved ones. So like we mentioned, a little bit of housekeeping. Any questions that you happen to have throughout the webinar, we can facilitate those through the chat box or the chat application in Zoom. Adriana Rodriguez Diaz is going to be supporting me through that. We also will send out a frequently asked questions based on all the questions that we get, a frequently asked question sheet after the webinar within the next few days. And if you feel comfortable, if we're not able to get to your questions, leaving your email, we can also follow up with you guys through email as well. So please feel free to work the chat there. So we'll get started. Really, this webinar is for clinicians, for parents, for teachers, any caregiver. You can ask yourself some of these questions to determine whether you're in the right space or not. Are meltdowns a source of stress for your child, your family, or yourself? Do you avoid some situations due to fear of meltdowns happening? Have you tried different strategies to reduce meltdowns without success, or have you just not even attempted it? You haven't gone down that road yet because it might cause stress or anxiety or fear. And then lastly, are you a clinician looking to hear some more information on why meltdowns happen and ultimately what to do with your clients in your occupational setting? So if one or more of those things apply to you, you are in the right place. And I think that you will learn a lot today. The first thing that we're going to touch on is problem behavior with autism spectrum disorder. So oftentimes problem behavior does coincide with ASD. Interacting appropriately with others, tolerating disappointments, and with this comes changes in routine or changes of environments that might be a little bit difficult, communicating effectively, and also waiting and being tolerant of different things are critical skills that are needed to develop relationships, access the community, and ultimately lead a life of independence, which is what we're hoping for all of our friends. Individuals with autism tend to engage in a higher rate of problem behaviors than their typically developing counterparts. So that much we know. We must understand why these problem behaviors happen so that we can respond appropriately. And I really want to kind of add that nugget of information in for you to keep that in the back of your mind. Problem behaviors happen for a reason, and we need to know why in order to address them appropriately. So that will kind of be our overarching theme here. Why did it happen, and what can I do to change it? Some objectives just to keep us on track. We're going to dive into why meltdowns happen. We'll also review some tips on determining why a meltdown occurred. And you can think back to some specific instances. I'm sure we all have a couple in the back of our mind of things you're looking to address with the knowledge that you gained today. So you can use those specific examples as we go through and just, really digging into the different occurrences of meltdowns. Overview how to set up a plan and respond to meltdown. So we want you to be able to create a plan that you can use in your everyday life to effectively change these meltdowns and decrease them. We'll review ways to prevent meltdowns and then applying that plan in real life and also managing our own emotions while we're going through these potential meltdowns. First, some expectations. The purpose of today, we're not going to give unique individualized solutions for every specific child. Every single child is different. Every meltdown looks different for everyone, and meltdowns can look different in every single circumstance for the same child. So if you need support individually, I would work with your child's village. If you have BCBAs or occupational therapists or teachers, anybody that can support you to be super individualized, I would absolutely encourage you to do that. We want to give you a general toolbox, a general plan of things that you can do to apply to your everyday life. We won't review extensive literature regarding interventions for problem behavior. There are so many. There are so many interventions, and they all really are related to kind of the function or the purpose of the behavior. So we're going to get you started out identifying the purpose and your preliminary steps. And then lastly, we won't critique other strategies and interventions that are used. We're going to focus on giving you the confidence and the toolbox you need to be able to start working on these meltdowns and teaching appropriate replacement behaviors. So with this, our goal is to provide you with those tools. You need to identify the reasons for meltdowns, select the ways to prevent them, and remain calm when they happen. And that sometimes is the hardest part, is being able to manage your own emotions when you're in the middle of a meltdown situation. So we'll touch on that. Meltdowns will still happen. That part is really inevitable. They're going to continue, but our goal is that if we can decrease them in the frequency that they happen and also the intensity, while increasing your confidence as the caregiver or the sibling or the service provider of working through them, then that is going to be a goal for us to reach today. The first thing we'll start out with is just a quick review of research. So like I mentioned, there is a lot of research about problem behaviors, meltdowns, tantrums, all of that in relation to autism spectrum disorder. There's not really any hard numbers regarding the entire community. It's mostly small sample sizes of how often children with autism do engage in meltdowns. But in general, studies have found that children engage in significantly higher levels of problem behavior than their typically developing peers. So according to literature regarding typically developing children, 87% of them from 18 to 24 months experience at least one tantrum per month. And to some of us, that might sound great. One tantrum a month, that's like no big deal to compare to what we're working with in our everyday lives. That number for typically developing children does rise to 91% during those terrible 2 years that we're all familiar with. But the thing that's pretty different is that between the ages of 3 and 4 and 5, that percentage basically drops off to 0 after age 5. For typically developing children, they really do phase out and age out of those tantrum or meltdown behaviors. For children with autism, they don't experience that same drop. So in studies that have looked at children with autism and their meltdown behavior, 56% of them had more than 3 tantrums per week. So now we're getting a little bit closer to what we're all probably experiencing at home. Tantrums happen more frequently, and also 92% of children with autism ages 1 to 17 have had a significant past of meltdowns that may or may not include aggression. So we're not talking about 2 and terrible 2s. We're talking about children throughout the lifespan that may engage in meltdown behavior. So it's important to work through a plan to be able to identify why and also to prompt appropriate replacement behaviors so that we can work to decrease these for our kiddos throughout their life. So why does prevention matter? Ultimately, we know that meltdowns are stressful for you, for your child, for your family. You might be embarrassed or worried or stressed or overwhelmed when your child melts down, maybe in public. You could have experienced that as well. And fear of those meltdowns can cause isolation for the kiddo and also for the family. So we want to make sure that we're working through these meltdowns so that they have access to the community on such a greater scale so that they can learn from their environment and be able to contact the natural environment. As we've learned from our statistics, meltdowns really can happen at any age with our kiddos with autism. So we want to make sure that we're preventing those so that there's no trouble with school, trouble with the law, difficulty finding jobs. All of that can be associated with meltdowns as we go through the lifespan. Ultimately, meltdowns can impact friendships and relationships with families. You may avoid going to family parties for fear of a meltdown, or bringing your child in the community. And so if we can understand and identify why they happen, we can work to prevent them and teach them more appropriate ways to get their wants and needs met. So in general, we're going to go through all of these steps a little bit deeper, but the general, what do you do? So we're going to understand what is and what is not a meltdown. We're going to talk about why the meltdowns happen, decide an easy way for the child to communicate instead of engaging in that meltdown behavior, following a plan of action, and then watch closely and modify. One of the most important things that you can do as you're working through these behaviors with your kiddo or trying to work with service providers to create a good intervention is to understand when it's not working and be completely fine with going back to the drawing board. We might need to do that sometimes, especially in the beginning stages. So we'll go through all of these steps a little bit more in depth. But first, really, what is a meltdown? And I'm sure if we're here, we all have experienced one from in our lives, or pretty much are very familiar what a meltdown looks like for your individual that you're thinking about. But it's important to know that the term is really broad and it varies widely depending on the child. So in general, a meltdown, it can also be interchanged with a tantrum. Those words are typically used interchangeably. It's a disruptive event that also includes some type of vocalization. So that could be crying, whining, yelling, anything vocal. It oftentimes includes some body movements. So that could be punching the ground, or we've all had the kiddo, flop to the floor or go limp when you're trying to bring them to the sink to wash their hands. All of those body movements can be involved in a meltdown or a tantrum as well. And then sometimes they include some aggression or self-injury. The meltdowns that we're really going to hone in on today are not the typically occurring. Every kiddo has a meltdown, at one stage or the other. 2-year-olds, they break their toy, they skin their knee. Those types of meltdowns, they just last a couple minutes. They might happen a couple times per day. But as the child gets older, those decrease. What we're really trying to focus on is the meltdowns that are more intense or more extreme. There are meltdowns that happen with 10-year-olds or 17-year-olds. Meltdowns that last 20 minutes, or they could be 2 hours long. Just in general, the ones that won't stop, they feel like they're inconsolable, extremely disruptive and stressful for everybody involved. Meltdowns, as I mentioned, can look different for everyone and in every time they happen. The same kiddo can present multiple different behaviors to make up their meltdown within a given day even. So we'll look a little bit at that and then try to figure out why those do occur. When we are talking about meltdowns, they can operate in different levels of severity. And this can happen within the same hour. It can happen in the same day, that there's different levels of severity within a meltdown. So some, they may not allow anyone to have aggression or anything like that, but they're still very disruptive. So yelling for the lollipop in the Target line is still disruptive, even though it doesn't include any aggression or anything like that. Some of the other ones can be high intensity, long lasting, and dangerous to the kiddo or to other people around them. But the good news is that regardless of the severity or the specific behaviors that make up the meltdown, they're treatable, they're preventable by teaching replacement skills and preparing in advance. So when we go into this, we're going to understand why they happen. And it could really be difficult to kind of suss out or determine why meltdowns happen in any given moment. It could be because of a communication issue. So that just doesn't refer to the children who are nonverbal, who have struggles communicating. Other kiddos who are verbal, who have extensive conversations, they can still have communication breakdowns that can lead to meltdowns. So there might be that going in the mix when you're trying to ask them why they're upset. They may or may not be able to communicate that with you. Environments in which they occur. So meltdowns can happen anywhere, and it might be difficult to determine patterns if it happened at the doctor's office, in the bathtub, at the Target. There's a lot of different things that go on in any certain environment. So it might be hard for you to pinpoint, why did this happen at this time? Or last time we went to the doctor, he was completely fine, and this time we had trouble. So the environment takes into account. Additionally, there also could be multiple triggers occurring at once. So maybe dad is playing with the sibling, the kiddo is hungry, grandma turned off the iPad, and then mom asked him to put on his shoes. So, and these things can happen in a very, very short time from one another, and might be hard to understand which one was the actual trigger or the actual thing that occurred. Basically, the straw that broke the camel's back to elicit or to evoke that meltdown. And then lastly, heightened emotions. Seeing a child that you love is upsetting to others. So you're upset when you see someone that you love being upset. If your kiddo's in a meltdown, that likely pulls on your heartstrings as well. So it can blur your rational thinking or the way that you remember events in the past when you're trying to think back. Why did that actually happen? You might remember it in an obscured way just because of the emotions that are involved, and all of those things are okay. When we break it down a little bit further, overall children primarily engage in meltdowns for one of three reasons. So to get something they want or get something that they like, they melt down, you give them a lollipop. If they melt down, they get iPad time. If they melt down, you give them a lot of attention. So they want to add something into their environment that they like, and meltdowns have proven to get them access to those things. So getting something. They can also do it to avoid something. So avoid doing homework or bedtime or going to the doctor. Those are things that might not be as preferred, and the kiddo could engage in meltdown behavior to avoid the onset or delay or escape those things that are not so desirable from happening. And then lastly, also for attention. So attention is a super valuable tool that we'll learn how to use appropriately later, but caregiver attention or attention of people around is super, super desirable. And so that can also be a function of behavior. One of the things I want to mention really quick regarding attention is that it's not always what you would consider positive or good attention can be the function of the behavior. So sometimes negative attention is still a function. So if you think you have your child playing quietly in the other room and you're like, leave them go, they're doing really well, they're being nice and quiet. In that circumstance, that kiddo is void of attention. So no attention's on them in that moment. They're playing independently. And then they might want attention. So they could say, oh, I know in the past, if I hit my sister or if I throw a car, mom's going to come in the room and say, don't do that, or provide some type of reprimand, but I'm still looking for mom's attention. So that reprimand is still serving my purpose. So when we think about attention, it's not always the positive attention. It also can be negative attention still serving the same function. And we'll revisit this a few times later on down the road. So why do these lead to a problem? Ultimately, lots of times the circumstance is they can't communicate well enough to get what they want, or they don't know how. They don't have the words, or it could be for attention. That's a complex thing to ask for. People don't usually walk around saying, I need attention right now. Usually they engage in attention-seeking behavior that gets them the attention that they're ultimately craving. So they might not be able to communicate their wants regardless of their level of communication. It can still be tricky for anybody. Or their efforts don't work, or it's just easier to engage in problem behavior to get their needs met. So in that circumstance, the little friend playing in the room, their efforts of playing nicely with their toys didn't get them what they wanted. They kind of reverted back to what their tried and true is crying or hitting sister to get the family member's attention. So if it didn't work out, they might resort to something else, something more extreme like a meltdown, to be able to get what they want. One thing to note is challenging behavior in general. There is a fourth function of behavior, which is for internal or sensory needs. However, most of the times that meltdowns occur, it's not sensory related. So we're going to focus on the big three, being get something, avoid something, or for attention. If you feel like your child does have sensory needs that leads to meltdowns, consult with your occupational therapist, and they'll be able to support you in that type of meltdown. But we'll focus on getting something they want, avoiding something they don't want, or for attention. So we can figure out why a meltdown happened by asking some questions about the circumstance. So what triggered the meltdown? And when we're speaking about this, we want to know what happened exactly before. So in the circumstance where there was all these different triggers in play, what really was the thing that led to the meltdown? That's going to be valuable information for us. And also, what did it look like? So you can sometimes create some patterns or identify precursor behaviors, such as they start to, whine a little bit before they go into a full meltdown to be able to intervene during the whining so it doesn't transpire into that big meltdown. So writing down and analyzing what the meltdown looked like as far as what behaviors comprised it or how long it lasted is super valuable for us as well. And then lastly, what did they get from the meltdown? And sometimes this might be a little bit of a hard pill to swallow if you realize, oh, he cried and I did give him the lollipop, or he cried and I really did let him go to the water park. Whatever the case may be, it's not shameful or anything if you ended up giving into a meltdown. This is super valuable information that we can use to design a really good behavior intervention going forward. So looking at what actually was the consequence is really going to be the ticket. So here's some examples. The child sees their favorite cookies at the grocery store. They engage in a meltdown, and their uncle gives them the box of cookies because they don't want them to yell in the grocery store. So that, as we see, a possible purpose for that meltdown was to get access to their favorite snack, to their cookies. The meltdown in the aisle of the grocery store got them the cookies, which is what they were ultimately seeking. In this circumstance, mom says it's time for bed. The child engages in a meltdown, then bedtime gets pushed back by 30 minutes because, okay, fine, you can have more iPad time. That's okay. So that in that case, the child was able to avoid or delay something that they really didn't want to happen, which was bedtime. And then lastly, grandpa is on the phone with his friend. Child's engaging in a meltdown. Grandpa hangs up the phone and picks up the child. Ultimately, the kiddo received grandpa's attention for engaging in that meltdown. As we talked about with attention, very likely grandpa didn't pick the kid up and say, I love you, I love you so much. This is so great. He might say, don't scream when I'm on the phone. So it could be a reprimand, but it's still serving as attention for the function of this meltdown in that circumstance. So keep thinking about it. It's not always positive attention. It could also be what we would consider a reprimand as well, still serving that same purpose of attention. So determining why meltdowns happen is, as we mentioned, challenging and complex. However, caregivers and clinicians, you guys and we all naturally analyze behavior all of the time. You can think about how frequently and how quickly you can guess why your child's having a meltdown in any given moment. So I know you can rattle off, oh, they don't like that show, or they want ketchup with their nuggets. They want me to pick them up. Everybody as parents and everybody as service providers, it's very, very easy to do this really quickly. Looking at behavior from this bird's eye view and be able to have this predictable way of looking at why the meltdown occurred is such a valuable tool when we're looking to identify the appropriate replacement behavior and to prevent those meltdowns. So the purpose of all of these examples is just to get you thinking about why the behavior happened so that we can identify what we're going to teach instead when we go forward into an actual plan. So the plan obviously is to decrease meltdowns. We have to determine why, and then we need to determine a more appropriate behavior that serves the exact same purpose as the meltdown. So because they all serve a purpose, every meltdown has a purpose for any person in any given moment. So there is a reason why that meltdown happened. We need to know why so we can change it for next time and teach them a more appropriate way to get access or to avoid whatever they were looking for in that moment. The easiest and most effective replacement behavior we can teach is communication. If the child can ask for what their wants and needs are, then we don't have to engage in problem behavior anymore or engage in meltdowns. And really, for all of our children, communication looks different. So just because we're speaking about communication, it's not always vocal speech. They don't need to speak to be able to learn how to communicate. Communication in general is still the easiest and most effective replacement behavior to teach right at the start. So it can be vocal speech. It also can be an electronic communication device, sign language, maybe a picture exchange system. Nonverbal communication is still wonderful. Pointing, thumbs up, thumbs down, shaking heads. I'm sure we can all agree that thumbs up or thumbs down instead of a meltdown is wonderful. That is major progress and something we would love to teach instead. So even children that can talk, have conversations, answer questions, they may also have communication issues, and we can teach them how to express their wants and concerns vocally if that's the way that they communicate. Ultimately, the key is to make communication easier than the meltdown and choosing the words or the actions or the symbols that are going to serve the same exact purpose so that we make the meltdown obsolete. No longer gets them what they want. This other communication response is what's going to lead get them the ticket. So if the kiddo is melting down to get cookies, we teach them to point to the cookies in the aisle and then they get the cookie. Pointing serves the same purpose as the meltdown. We don't need to engage in the meltdown anymore because pointing is going to get you the same exact outcome. When we're thinking about communication and what easy communication response we're going to teach, you can ask yourself a couple things. What can your child do really well? Are they good at pointing? Are they good at eye contact? Are they good at requesting with one word? Can they use their device really, really well? What can they not do? We want to make this communication response easy. So we're not going to do something that's super complex. We will have goals to work up to a more complex communication response. But to start, we don't want to do things that they can't do. Is there something that you ask that makes them upset? How can you make the communication easier in any given moment? And do they understand things when you ask them? Or how is their receptive language? We want to consider that as well. And if so, we might need to make some adjustments to make this whole system effective. So at the start, like I mentioned, communication should be on the easy side. It includes the directions we give. Simple is best because we can always teach them to do more later. So when we're trying to decrease meltdowns, we're climbing up a large hill sometimes. They have a learning history that meltdowns get me cookies or meltdowns get me attention. And we have to kind of reverse this for them, flipping it on its head. So in that case, pointing sounds great. That's absolutely fine. Or having smaller responses of communication is going to work. We want it to be easier than engaging in the meltdown. And then over time, you can increase your expectations. One of the things you can also do and that I would recommend would be consulting with your child's speech language pathologist. If you guys are in the process of working on what communication modality you're going to implement across the board with your kiddo, they might say, I think sign will be best, or I think a communication device will be best. However, you and your speech language pathologist determine is the best place to communicate. That's great. That's a good place to start. If all else, if you're still in the kind of the beginning phases, you can use a nonverbal communication like a head shake or like a thumbs up and thumbs down. Here we'll look at the same examples that we touched on before, but with some potential replacement behaviors that are linked to communication. So the child sees their cookie in the grocery aisle before they would melt down to get access to the cookie. When we're thinking about replacement behaviors, maybe they can sign cookie instead. Signing cookie in the aisle, that's wonderful. The uncle can give them their box of cookies. And when we look back at it, the meltdown and the signing cookies served the same purpose. And we want to make sure we're promoting that potential replacement behavior. So when you're thinking to identify a replacement, making sure it serves the exact same purpose as what that meltdown did for them. Mom says time for bed. Instead of melting down this time to get an extended bedtime, they can say 5 more minutes, or they can hold up 5, or they can say 1 more minute, or they can exchange a picture that says 30 more minutes, please. that communication response is much more desirable than the actual meltdown. So that's an appropriate replacement behavior that serves the same purpose of the kiddo avoiding or delaying the bedtime, which was the non-preferred thing that they wanted to do in that moment. And then lastly, for grandpa, he's on the phone. Instead of engaging in the meltdown, the client can touch grandpa on their electronic communication device or tapping grandpa on the shoulder to get his attention. And when you think about it this way, if they obtain their attention through saying grandpa or touching grandpa or tapping grandpa, the grandpa is likely going to have a much more positive reaction and implement positive attention toward the kiddo than if they were to be screaming and crying and engaging in a meltdown. So grandpa hangs up the phone and says, "Hey, I love how you want my attention. Let's play," or whatever the case may be. Or next time, can you wait till I'm off the phone? So the attention that can come from the replacement behavior is likely much more positive than the attention that they were getting from the meltdown. One of the things that's really going to be the deciding factor in whether or not these replacement behaviors work is reinforcement. So reinforcement, the term is used all the time, sometimes incorrect, sometimes in different contexts. But ultimately, what reinforcement is something that is added or removed from the environment that increases the chances of a behavior happening again. So when we're talking about those contingencies, we want to make sure that we're adding something like cookies or like grandpa's attention, or delaying something such as the bedtime or the visit to the doctor, whatever the case may be, delaying something not as preferred to increase the chances that that behavior will occur again. So if the kiddo's engaging in meltdowns to get access to cookies and they get cookies from that, then we just reinforced the meltdown. When we're trying to intervene, meltdowns are no longer going to get you access to cookies. We're going to use reinforcement for the signing of cookies in the previous example. So we inadvertently reinforce maladaptive behavior or tantrum behavior all the time, and that's okay. Part of it is identifying that we've done that so that we can switch it up a little bit going forward. We have to use reinforcement of appropriate behaviors to increase the chances of the replacement behaviors happening versus the meltdown. So in our contingencies that's been the theme throughout, in this circumstance, we would add the reinforcement, which is ultimately access to those cookies after the child signs cookies and no longer when they engage in meltdowns. So meltdowns are obsolete. Only signing for cookies is what's going to get them the cookie. Then over time, they're learning, oh, I just have to sign cookies to get what I want. Great, I'm going to sign cookies. For our kiddo going to bed, no longer is the meltdown going to get them reinforcement of a delayed bedtime, but we're requiring that the kiddo says 5 more minutes or shows up a 5 sign to delay that the bedtime from happening. So it's the same reinforcement, we're just giving it for a new behavior so that we can increase the chances that that new behavior will occur again. They're starting to learn. In order to delay my bedtime, I have to ask for 5 more minutes. And for grandpa, in this case, the meltdown is not going to get the kiddo or the grandpa to hang up the phone or the kiddo some attention, but requesting appropriately is going to. And then they learn, oh, I just tap grandpa on the shoulder going forward. That's how I can gain access to attention. And that's how we're going to change this learning history. One of the things that we will send out after the webinar is a checklist that looks like this. This might be helpful for us at home to be able to determine why did it happen? What's the purpose? What replacement behaviors should I identify and how can I reinforce that? So with this checklist, you want to identify the trigger. So what happened immediately before the behavior? Then we're going to start to look at those patterns. Why did the meltdown happen? What did it look like? How long did it last? What behaviors happened during that meltdown? What was the purpose of the behavior? It could be access to something, attention. Remember, where it might be avoiding something we don't like. So that's kind of setting up the stage of figuring out the purpose of the meltdown. Then step 2 is going to be the replacement behavior. So they did this to get access to attention. What can I teach them? What simple communication response can I teach them instead, tapping on the shoulder or saying mommy, to get attention in a better way? That's going to be my replacement behavior. And then lastly, how am I going to ensure that this replacement behavior is what is going to continue going forward and the meltdowns will decrease? And that's by picking the appropriate reinforcement. So for the reinforcement, it needs to be the same reinforcement or more or better than what they would have gotten from engaging in that meltdown. So if the purpose is attention, the reinforcement's attention. If the purpose was access to cookies, the reinforcement should be access to cookies. So we need to make sure that that's mirrored. So potentially graphing out some of the meltdowns that you've experienced can help you identify an appropriate replacement and also how you're going to reinforce that behavior to ultimately change the behaviors over time. So over time, you're going to see meltdowns go down and communication go up. And that is really what we want to see. We want to see that paradigm shift. We want to tip the scales so that they're learning communication gets me what I want. And meltdowns they're not working for me anymore. Mom doesn't give me the cookies or grandpa doesn't give me attention when I engage in those meltdowns. When communication gets them what they want, they're going to continue to communicate in the future. So having said all of that, we've kind of figured out, we have to figure out why, we have to figure out what we can do to replace it, and also how we're going to ensure that happens again in the future. So when you're in the middle of a meltdown, how do you respond? Because sometimes they're still going to happen. Despite all of the strategies and looking at behavior from our bird's eye view with our data or our descriptions in our checklist, they're still going to happen. As we discussed with reinforcement, how we respond to the meltdown is going to determine if it was accidentally reinforced and inadvertently more likely to happen again or not. So if we're responding, we're giving direct instructions, we're not responding to the maladaptive behavior or that meltdown, but we are responding to something more appropriate that they're doing, that's going to turn the difference, and that's going to cause those meltdowns to decrease. So don't give in to the meltdowns. Even though meltdowns, they'll stop if you give in to them, it actually will make things worse over time because it's showing them that sometimes meltdowns do work for me still. And they might try, every so often to engage in that meltdown to determine if it's going to work this time or not. If we're telling them meltdowns are no longer going to get you what you want, but tapping me on the shoulder will, or asking for what you want will, then that's going to change the learning history there. And again, a tip on reinforcement, the immediacy of it is super, super important. So as soon as they do something more desirable than that meltdown, don't wait. Give them that reinforcement, because that's going to start to make those connections that I did this and then I got my reinforcement. I did this and I got my reinforcement. So that's how we're going to change those behaviors and make them more likely to occur again in the future. Great things should happen when we're engaging in appropriate behaviors or more desirable behaviors than a meltdown. But ultimately, we shouldn't get access to the things that we want or attention when we're engaging in those meltdown behaviors, because we're teaching something more appropriate. In short, when meltdowns do happen, pause. Try to think about why it's happening. Don't give in the moment and don't say too much. We can always debrief later on and turn this into a learning experience. But what you can do is help them do something more appropriate that gets them access to the same thing. So we want to make sure that we are using that same reinforcer for whatever the meltdown was serving for this new replacement behavior. And then after they've done it, we should throw a party because they've been able to engage in a more appropriate replacement behavior. When putting this together, we want to make sure that when we do give reinforcement, that you can be as consistent as possible, because the more times you can make that connection of I did this, I got reinforcement, then we're going to change that learning history a little bit quicker. Thinking about what communication response you can teach instead is super, super valuable in that moment. We don't want to reinforce the meltdown. We want to reinforce some form of communication. And it's okay if at this time it's extremely easy. You can build your expectations over time. It's also okay if you're in the middle of a meltdown and your child, they can ask for extensive sentences. Mommy, can I please have a cookie? Thank you. But in the moment, they're not able to do that. Pointing or a lesser response is still better than the meltdown. So you can still reinforce that just to get out of that meltdown situation. A pointing is still better than a meltdown. So even if your child can engage in a more advanced response, it's okay to accept something less so that you're able to get out of that situation and ultimately, kind of come to a nice resolve. Some additional prevention tools. So we talked about the whole entire flow, thinking about that replacement behavior. How are we going to reinforce it? But there are some other things that you can add into the environment that can just support in everyday life or everyday transition, which include the prevention of meltdowns. So firstly, providing choice when something is unavailable instead of just saying no. So saying no is difficult to handle, right? You're saying no, but you're not telling me what else is available. So sometimes when you're going to say no, what you can do is provide a choice. So they're asking for cookies, they're not able to always get cookies when they ask for it, but grapes or pretzels are available. And when you provide this choice, it gives the kiddo autonomy, it gives them say in what's going on, it shows them what is available and allows them to make a choice. So when you have to say no to something, instead of that, use an alternate by providing choices of things that are available at that time. iPad's not available, but coloring or reading is, and have them select the option. So this can prevent the onset of a meltdown. It can help to avoid a potential meltdown trigger. Also, using a timer. Timers are a great visual representation for kiddos to support with transitions. So you can support this by either setting a timer. We have 20 minutes on the iPad, and then we're going to go to school, or bedtime's in 30 minutes. And when that timer goes off over time, they realize, oh, the timer is signaling to me a transition, or they can visually see how much time they have left with any given activity or before a big transition's coming. So that can help prevent a meltdown trigger as well. Using first then language. So sometimes this is called grandma's principle, where it's eat your veggies and then you get dessert. We can use this as a really, really valuable tool to set expectations so that the kiddo can predict what's going to happen next, know something non-preferred that they want to do, but then they're going to get something that they do want to do right afterwards. So first we're going to go to the dentist and then we're going to go to the park, or first have your sandwich and then you can have some chips. So using first then is a really great way to show and give the contingency of what's going to happen going forward to potentially prevent a meltdown trigger. You also can use your attention. We talked about attention a lot today, and attention is so valuable as a valuable behavior change tool is what it is. So you can use your attention for the desired behaviors you're looking to see. So when you see your kiddo in the other room playing nicely with their cars, that's when you should go in and give your attention and play with them and make it really fun so that you're showing them this was a really desirable behavior. I want to give you some reinforcement. I want to give you give you some attention for this, and that can help create behavior change versus always giving the reprimands or saying no or correcting when things do happen. If you just use your attention positively when they do things that you are looking to increase, you're providing reinforcement, which will increase those behaviors from happening again. That is a very, very valuable tool you can use when you're working to create behavior change and preventing meltdowns. And lastly, the most important thing that we can do throughout this entire plan we have going on is to practice in times when they're not in meltdown mode. So if you set up environments where maybe the cookies are on the top of the fridge, they have to ask for them before it gets to a meltdown. Or if you're playing in the playroom and you have your cars and you want them to touch car on their device, and then you can give them cars, practicing these simple communication trials, or you can turn your back and see if they tap you for attention. Those are all ways that you can practice in a more relaxed environment and have the new behavior. So have that communication response, contact reinforcement, contact the cookie, contact the attention, will increase the chances that that behavior happens again in the future. So when we get to a meltdown trigger, they have this learning history of signing cookies has gotten me cookies in the past. I'm going to try to do that and see if it works this time. And if it works, great, we've provided reinforcement and that behavior is more likely to occur going forward. So practicing in moments when we're not in meltdown is super, super valuable for you as well. In planning for real life happens. Every meltdown's, you're not going to be able to identify the trigger and implement this perfectly every single time. But what we can do is learn from it so that we increase our skills going forward, to maybe handle things in a different way going forward. But it's still going to happen every so often. You can do it right 3 times and then you give into a tantrum on the 4th time. And that's okay. That's real life, right? But the best thing that we can do is make the most out of the situations. Wait for them to lessen. So wait for the meltdown to lessen, and then have them ask you for something, or have them point at something. When we're initially teaching these behaviors, you have to tell them the expectation. So they went from meltdowns, getting them access to cookies, and now we're going to change it to they have to sign for cookies. You have to support them through that to show them the new expectation and then provide reinforcement for that. So in real life, it's okay to give hints, it's okay to give prompts, it's okay to show them what you're now requesting or now what your expectation is now, so that they know what's expected going forward and they can continue to try that as they go through their learning history and their everyday life. When life happens, just make sure to not fully give in to the meltdown. It doesn't have to be perfect, but any response that's a little bit better than the meltdown, even if they cease crying for a little bit of time, that's a moment where you can use to capitalize, to prompt something like a point, give the reinforcement, and get out of the meltdown situation. Managing your emotions. We kind of discussed that we were going to touch on this a little bit. Meltdowns are super difficult to work through. The setting, how many people are involved. There could be multiple people giving instructions at one time. It is a very, very high intensity situation, and it's okay. Just remind yourself that it's going to be okay. In this moment, the meltdown is the most efficient way that your child has learned to communicate thus far. And so that's why we have to teach them or give them hints and give them prompts of what to do instead next time. They can learn, and it's going to take time. It's not going to be perfect every single time, or it's not going to work immediately. But overall, if you're being consistent, you're sticking to the expectation, you're providing support and also reinforcement after that new behavior was engaged, then that's how we're going to create some behavior change. There's always tomorrow. Today may not have been a good day. You might have been making dinner with other children around, and there's a meltdown right in the middle of the kitchen. It's okay. There's always tomorrow to try. What I would, in that moment, look at is, did I have the purpose correct? Do I know why this happened so that I can reliably teach a replacement behavior going forward? And also remembering to do that in instances where we're not in full meltdown mode. If you're not seeing any changes, you should see changes after a few days. If you have the correct purpose and you have an easy replacement behavior that serves the same focus. But if you don't, that's okay too. I would double check, is the purpose of the meltdown correct? Are you correctly identifying why this happened? Because if we're in the grocery store and the kiddo's melting down for cookies, but uncle's giving attention, that's not serving the same purpose. So they're going to revert back to the meltdown because they're ultimately trying to get the cookie. The attention was not the correct reinforcer in that moment. So check in to see if you think that you have the appropriate purpose and the appropriate replacement behavior. Use a data sheet, use a checklist, create your own way to monitor meltdowns and try to look for patterns. If you have other support in your village, talk to the teacher, psychologist, BCBA, other related service providers. Getting a second set of eyes when we're trying to identify function is super valuable as well, and can maybe support you in seeing something that you did not originally. You can mix it up, try something else for a few days. Think about all those other prevention strategies, such as providing choice or using a timer, using first then language. Add these things into the mix so that maybe you can prevent the meltdown trigger altogether. Being consistent and making sure that others are too. So if meltdowns still get the kiddo cookies in one situation, but for you, it no longer accesses cookies, that's going to be confusing and ultimately not be the most successful for behavior change if in some instances it does work still and other instances it does not. And ultimately talk to your child's speech therapist to work through communication challenges if they're present. You can use a multitude of different forms of communication to still teach a simple response that can replace the meltdown, given the same circumstances that serve the same purpose. And lastly, consult with your doctor to rule out other possible issues. Ear infections, toothaches, constipation, all of these things can have an effect on meltdowns. And so we always want to make sure that we've ruled out anything that could be going on affecting the outward behavior. And here's all of our references if you guys are interested. I know Adriana's been working hard in the chat box. Oops, sorry. My chat box went away. I know Adriana's working hard in the chat box. If you have any more questions, I'm happy to answer some, or we will have a frequently asked question handout that'll go out. We also have the checklist that we showed earlier that will go out to you as well, so you can use that resource at home. And I did want to mention that we do have another webinar coming up with Pathfinders. So Wednesday, September 25th is the English presentation, and the Spanish is on the 26th regarding Intro to ABA. So if you'd like, you can sign up through the QR code here to join that webinar as well. But I really appreciate everyone's time today. I hope that you learned something. I hope that's something you can take home and add to your toolbox when working through meltdowns. But we will have those resources to you all within the next few days to support. If there's any last minute questions.
Can you stop sharing so we can sort of bring everybody back? That's okay.
Sorry about
Thank
that.
you. That's quite all right. Thank you. Let's see. All right. So thank you very much. I thought that was a really great presentation. And I've learned a lot, even though I have a 30-year-old. So I still you learn something all the time. So thank you very much. And I'm going to stop recording at this point, and we will make the recording, as I mentioned, available